So, I'm going to try and translate all that information into what's happening at a GM level, then Tom will translate it further down. So, I guess this is the quote that holds me when I'm doing this work. How many times have you been in a room or gone into a meeting and you've gone, I'm going to change it. I'm going to go in there and we're going to be different and we're going to think different and it's all going to be different, and you come out the meeting and you go, that was exactly the same as the last time I went into that meeting. And then to expect a different outcome. I know I've done it loads and loads and loads of times. What we're trying to do with the pilot is actually we do go into those meetings and it is a different conversation. And therefore the outcome is going to be different. And the way we work is going to be different. And the impact we have with those communities is going to be different. So what if I told you that we can do that? That this is the space, this is the place where those conversations can be had. Where you can choose to take the blue pill and continue as you are, or take the red pill and go down the rabbit hole. And follow the conversations and give yourself the time. And disregard the unit and think about the individual. Think about the person. Think about that community that you're trying to have an impact with. Where you have the permission to be creative and innovative. Where you're not going to go in the room and everyone's going to look at you as you make something up. You say something and you go, and they go, what does that mean? Or actually we go, that's interesting. Can you explain that a bit more? Where have you got that idea from? How would that idea work with the communities that we're trying to work with in Greater Manchester? But there is a flip side to that. In order to embrace the red pill, you have to be open-minded as well. We want people to come into the room, to sit at the tables and go, how can we help you? How can you help us? What we don't want to see are people coming into a room and going, we've got this, it works, now just use it in Greater Manchester. Because that doesn't capture how we're trying to work in GM. And that won't capture how we're trying to work in each of the 10 boroughs. By all means, come into the room. Please come into the room open-minded and willing to change and think differently. So this is how I try and describe the way we're working in Greater Manchester. Because there's Greater Manchester moving, GM moving, then there's GM local pilot, then there's a Trafford local pilot, and then there's the individual. So I've tried to use it as Russian dolls. GM moving is the big doll. GM moving is that doll that's having the conversations at a strategic level across Greater Manchester. It's talking to the Health and Social Care Board, it's talking to the strategic influences across the region, it's talking to the education influences across the region. It's having those big conversations. The local pilot fits very neatly within inside that, and we're operationalising those conversations at a borough level. So we're having those conversations at a borough level to try and say, well, actually, in Bury, this is what that conversation looks like. This is what the change would look like as a borough in Bury, in Trafford, in Salford, and in all the others. Inside that conversation, we're going to hyper-local. So we're going into various estates and having different conversations with those communities. We're not talking about the things they can't do. We're not surveying them. We're sitting down having those meaningful conversations to understand what is it you can do? What are your individual strengths? What are your community strengths? Where are your facilities and your assets that we could be utilising to get people moving more? How do we embed moving more into your daily routine? And then sitting with that one is the individual. So how do we work with that individual and have that conversation with the individual? And it all takes time. But the beauty is we've got time. We're allowing ourselves to have the time to have those conversations. As Kay alluded to, this is the whole system approach. We're using the same theory of whole system, the individual at the centre of what's going on in a place, and all the social determinants which impact on that individual's behaviour and attitude towards physical activity and moving more. So what does their friendship group do? What does the place do? If you're living in a place where there's just cars whizzing up and down the street, how does that impact your ability to think about moving more? Do you think that being physically active means going to a gym? Does it mean that you have to be sporty to be active? what does that environment look like? How can we make the environment more appealing to be more active? Those conversations will then include your planners, so we draw them into the room. But we know it's really messy. It's messy at a strategic level, it's messy at a community level, it's messy in every sector we talk to, but we have to just work through that. And that is part of the fun, to understand it and work through it, and it's definitely part of the challenge as we move forwards. Across the 10 localities, we've basically given ourselves some key principles that we will work to. I'll probably draw yourself to the first 3, because they're where we are right now. Every decision we make is based on insight. It's based on the evidence, and where the evidence leads us, and where it takes us. We've done lots and lots of data crunching, of using spreadsheets, of using data to make the decisions about where we're going to work and the places we're going to go and influence. We keep talking about these individual and community assets. What do they look like? Where are they? We don't talk about hard-to-reach groups anymore. They're not hard to reach. We just haven't found a way to find them. They're out there. They're willing. They're ready. We just need to go and find them. We're working really closely with our VCSE community and sector. So we've made a conscious decision to say, well, actually, the community sector are the ones which will create that empathy. Not necessarily local authorities with our lanyards, and we go into those community groups with a lanyard on that says, Wigan Council, and they go, yeah, I'm not engaging with you. We've engaged with you before, nothing happened. With those community groups, those connectors that understand where those people are. We know it's a whole system approach. We keep talking about that whole system approach and making sure that the right people are in the right room at the right time to have the right conversation. And it's fluid. You're not always going to be in the room. You might not always want to be in the room, but you want to be there at some point. And I guess the other one I would draw your eyes to is embrace innovation. Is what we're doing going to be different? Or is it going to build on things that have worked before? And distributed leadership. We're not the experts. No one in the room is an expert on everything that's going on in a system. So how do we draw on that? When do people want to lead? When do we take a step back? And how does that flow work as a relationship? And this is the map. This is what's going on across Greater Manchester. So whilst we've got GM City Region as one local pilot, then we've got 10 local pilots happening within the City Region, then we've got 20 local pilots happening within the 10. So if you took that on a scale based on the 12 that we're working with nationally, you've got GM, you've then got Calderdale times 10, and you've then got Withensea times 20. 3 different systems, all very complex, all very challenging. We're trying to get them all to move in the same direction, so that moving more is more embedded in the conversation, that it's not the afterthought. That actually we're being invited into the room as opposed to trying to knock the door down to get into the room. That we're having those meaningful conversations that are making a change in the way people think about their work and our agenda, and how we're thinking about their agenda and our work. And this is what it feels like. And when you come into, and you're working with us, and some of you may be working with us already, we don't know necessarily where this is going to take us. We know by 2025 there's this vision that 75% of people in Greater Manchester are active or fairly active. We know that's the long-term destination. How we get there through the local pilot work, we're still laying the tracks as we go through. Every day is a different track. Every day is a different direction. And that's part of the beauty of working here. And if you're ready to embrace that challenge, if you want to work in that environment, then this is the place to do it. Because what we can do here is we can shout really loudly about all the good work that's going to be going on here. We can scale it. We can use it. We don't have to be fearful about things going wrong. We've got the permission to test, to learn. We've got the permission, if things don't work, to understand that and go again. And I think that is a real opportunity for everybody in this room, and when you go out of here, to tell everybody else how we want to do this.